First at 5 tonight, we're getting a clearer picture of when Southern New Englanders may be vaccinated against COVID-19. Good evening, I'm Mike Montecalvo.
And I'm Shannon Heggie. Right now, the Rhode Island Department of Health is holding a Zoom meeting to discuss who will take priority when a vaccine is administered. But first, Massachusetts has ordered tens of thousands of doses of Pfizer's COVID-19 vaccine and plans to start distributing it very soon. 12 News reporter Logan Wilbur explains when that may happen.
Governor Baker says 60,000 vaccines could arrive in Massachusetts as soon as next week. However, for most people, the ability to get a vaccine is still months away. As coronavirus cases surge, Massachusetts officials announce a plan for vaccine distribution. Healthcare and other frontline workers are prioritized in a three-phase plan announced by Governor Charlie Baker.
Healthcare workers doing direct and COVID-facing care. Long-term care facilities, rest homes, and assisted living facilities. Police, fire, and emergency medical services. Congregate care settings, including shelters and corrections.
The CEO of Greater New Bedford Community Health Center, Cheryl Bartlett, says this will allow care to continue for others who will be sick and hospitalized with the virus.
As the community level of spread rises, so do more healthcare workers become exposed and positive. And so there's a huge amount of absenteeism that's going on that makes it very challenging to manage staffing and providing health services.
Baker says the state should receive 300,000 vaccines of the first of 2 doses, with 164,000 to clinical and non-clinical healthcare workers. Cheryl Bartlett says those quantities are likely not enough for the entire state.
The South Coast has thousands of employees, so pretty quickly you use up 160.
Vaccine quantity isn't the only concern for Cheryl, who says the people who are most vulnerable to the virus will still have to wait months for the vaccine.
Many of the minority populations are very underrepresented in that workforce, particularly in the doctor, nurse, clinical realm.
Coming up tonight at 6, Cheryl Bartlett will explain what this vaccine distribution plan means for areas like New Bedford, where case rates are high among minorities and many people are working hourly and low-paying jobs. I'm Logan Wilbur, 12 News.
Meanwhile, Massachusetts is also expecting its first round of vaccines to arrive next week. Today, Governor Charlie Baker announced the state's distribution plan, which is broken into 3 phases. Phase 1 includes healthcare workers, nursing homes, and first responders, which will run now through February. Phase 2 includes people at highest risk, those over 65, and people who work in schools, grocery stores, and other frontline jobs. It's scheduled to begin in February and run through April. Everyone else falls into Phase 3, scheduled for April through June. 12 News reporter Logan Wilbur continues our team coverage with local reaction.
Under the vaccine distribution plan announced today, essential workers are in Phase 2, while the general public is in Phase 3. For many people working hourly and low-paying jobs, that means waiting months for a vaccine.
Communities of color and at-risk populations will be prioritized throughout this process.
Most of the people getting it won't be in a disadvantaged population. We're probably kidding ourselves to think we're really trying to do this with an equity lens.
Governor Baker's vaccine distribution plan puts healthcare workers and first responders at the front of the line. With essential workers, many hourly employees, and the general public waiting at least 3 to 6 months before a vaccine is available. Greater New Bedford Community Health Center CEO Cheryl Bartlett says after newly announced business restrictions, the hourly worker is at even greater risk.
Because if we're going to start shutting down restaurants again, those are people sort of making minimum wage, keeping a lot of these restaurants open.
New Bedford industries common among minority workers, such as the fishing industry, are already facing concerns related to the virus.
I've met with them on a number of occasions to let them air their frustrations at really not having equity and protection and not only PPE.
In New Bedford, more than half of all coronavirus cases are in minority populations. Cheryl says the vaccine distribution plan puts minorities at the back of the line, while most work in jobs where they are often facing an increased risk of exposure. Governor Baker said the state is set to receive about 300,000 vaccines for Phase 1. The state population is closer to 7 million. During the announcement today, Baker's team said it could take 6 to 9 months before enough people are vaccinated so that we can return to life without restrictions on businesses and without wearing masks in our everyday life. Logan Wilbur, 12 News.